Animal protein is high in sodium to begin with and low in potassium. Vegetable protein has no sodium in it until you add some, and is very high in potassium and magnesium, and both of those substances actually lower your blood pressure. So it's important to have, once again, why am I talking about beans and lentils and tofu and tempeh? Because this is a part of that organic, unprocessed, whole foods dietary program that I talk about. Here's an article that talks about that A1C, the association of the A1C with the severity of coronary artery disease. And what it says here is the higher that A1C, the higher your average sugar over the course of several months' time, the more severe coronary artery disease you're going to have. Here is an article that says intensive cholesterol reduction lowers blood pressure and large artery stiffness. In other words, if you really rock the ship and get your cholesterol way down low, it actually improves your blood pressure too and makes your blood vessels more flexible. Sodium content, to go back to that, here's some sodium content. I want it to be as close to 0 as it can be. 3 ounces of ham, 1,166. 1 medium avocado, 20. 1 medium orange, 0. Half cup of salted peanuts, 297. 2 ounces of cheddar cheese, 352. Half cup of pretzels, 170. So you can see that the processed foods, by definition, are higher in sodium, and the whole foods have little to none. Whole foods meaning whole vegetarian foods. Here's an article that, this is a reminder of the article that I was reading about last night. And it talked about some people who had a natural tendency not to have large amounts of the bad cholesterol, the LDL cholesterol. And what it found out was that their incidence of heart disease was reduced close to 90%. Whereas if you take people who had the same cholesterol levels but were at 50 or 60 years old, they had about a 30% chance of having a heart attack in a very short period of time. So this says early intervention can halt heart damage. And this is starting to drive at the idea of either by natural means or by medical means of treating people in order to prevent heart disease, but treating them in their 30s or 40s as opposed to waiting until they get to be the 60s or 70s. Those of you who are interested and may be aware of the Framingham score, I am not a fan of the Framingham score. It looks too much at age and doesn't look at the numbers. The Framingham score does not take into effect the concept that 1 out of 2 people is going to have a cardiac or stroke event and die of that disease. And I'm trying to address that portion of the population that is 50%. At the same time, the one-size-fits-all, the put-it-all-together concept, the program that I would have you follow also is preventative for diabetes, high cholesterol, high blood pressure, cancer of the colon, uterus, breast, prostate, because those diseases don't occur unless we make them happen. So what I'm saying to you once again is that concept. There is a natural human design, and we need to follow it.